An article released by the New York Times on February 22nd by Pam Bullock states, the Trump administration announced on Friday that it will bar organizations that provide abortion referrals from receiving federal family planning money, a step that could strip millions of dollars from Planned Parenthood and direct it toward religiously based anti-abortion groups. This rule is identical to the Mexico City policy, or the Global Gag Rule, implemented by former President Ronald Reagan in 1984. The Global Gag Rule requires non-governmental organizations such as Planned Parenthood International, Marie Stopes International, and the United Nations Population Fund, among others, to adhere to strict guidelines to receive American tax money. American tax money is not allowed to fund abortion procedures via the Helms Amendment, passed in 1973 by the U.S. Supreme Court, which limits foreign assistance to abortion in other countries. The Helms Amendment states, no foreign assistance funds must be used to pay for the performance of abortion as a method of family planning or to motivate or coerce any person to practice abortions. In 1976, the Hyde Amendment was passed, which blocked all federal funding to abortion domestically. However, all states are required to fund abortion through Medicaid in cases of rape, incest, or when the mother's life is endangered. In 1984, the Mexico City policy was implemented, which takes this a few steps further. Under the Mexico City policy, more widely known as the Global Gag Rule, not only will all foreign aid be barred from abortion procedures, but all foreign aid will be barred from any organization that provides or promotes abortion, using their own funding. By promote, I mean inform their patients about that option or possibly provide a referral. For example, Marie Stopes International provides many services such as contraception, STD HIV testing, wellness exams, prenatal and obstetric care, postpartum care, training skilled birth attendants, etc. Under the Helms Amendment, those services would be funded. Under the Global Gag Rule, none of those services are currently funded because Marie Stopes International also provides abortion care. Imagine there are two women named Mary and Sally. Imagine Mary gives Sally a $5 gift card to Starbucks, but before giving Sally the gift card, Mary says, I'm going to give you the gift card if you promise not to spend the $20 already in your wallet on a Slipknot CD. That's bad enough as it is, right? Well, the Global Gag Rule is even more restrictive than that. Imagine after saying all that, Mary then says, not only are you not allowed to buy that Slipknot CD, you aren't allowed to tell any of your other friends about the band or tell them which stores currently have the CD in stock. According to Marie Stopes International, every year, 25 million women all over the world receive an abortion at the hands of an untrained medical professional. And this has led to 31,000 deaths and 8 million serious complications. Not only are we defunding this crucial service, we are doing everything in our power to discourage organizations from even offering or telling their patients about the procedure using their own funds. Unfortunately, the Trump administration is trying to bring the Global Gag Rule home. The Domestic Gag Rule would affect those receiving services via Title X. Title X was passed by Richard Nixon in 1970 under the Public Health Service Act. Currently, 4 million women, 78% of which live at or below the 78% of which live at or below 100% above the federal poverty level in America rely on Title X for reproductive health care such as contraception, wellness exams, cervical and breast cancer screenings, and STD and HIV tests. Planned Parenthood sees 1.6 million women who rely on Title X. Because Title X is a federal program, as long as the Hyde Amendment is in effect, which it is, Title X does not fund abortions. For nearly 2 decades, Title X law has been clear. Healthcare providers cannot withhold information from you about your pregnancy options. The administration's gag rule means they can, and that they must. Every year, Title X prevents over 1 million unintended pregnancies, some of which would have definitely ended in abortion. This policy is something that everyone, no matter what your stance on abortion is, should be against. Currently, on March 5th, 2019, 21 states already have or plan to file a lawsuit against the Trump administration for trying to impose the Domestic Gag Rule. In the past, similar laws and rules have been deemed unconstitutional for violating freedom of speech and were overturned. Not only does this violate the Constitution, it violates the medical ethics and the tenet of informed consent. No wonder that it is currently opposed by the American Academy of Pediatrics, the American Medical Association, the American College of Nurse Midwives, the American College of Physicians, American Nurses Association, American College of Obstetricians and Gynecologists, and Physicians for Reproductive Health, among others. So what can you do? Well, if you live in the following states: California, Colorado, Connecticut, Delaware, Hawaii, Illinois, Maryland, Massachusetts, Michigan, Minnesota, Nevada, New Jersey, New Mexico, New York, North Carolina, Oregon, Pennsylvania, Rhode Island, Vermont, Virginia, Wisconsin, and the District of Columbia, then your state is already suing the Trump administration over the dogmatic rule. If you live in Kansas, Louisiana, Maine, Montana, or Washington, then you have a Democratic governor who isn't yet part of this coalition. I think we can at least strive to get those states in the coalition, but don't rule out your state just because you have a Republican governor. We shouldn't concede any state to this effort. So please call your state governor office, and together we can put pressure on Washington to stop the domestic gag rule from going into effect. Thank you.